You're listening to the Pace Radio Network, here at paceradio.net.
The views expressed by the individuals during this broadcast are their own opinions, and they may not be the same as those of their group or other organizations they may be involved with.
Battle Strategies with Green Irene, here on the Pace Radio Network. Sharing strategies that combine the curative powers of cannabis, the healing suggestibility of hypnosis, and the power of neuro-linguistic programming to help you help you. Control chronic pain and fatigue, eliminate negative patterns of resolve, and build a brighter, healthier, happier you, starting now. Hello, and thank you for tuning in. I'm your host, Green Irene. I'm an author, a researcher, a cannabis enthusiast, medicinal and recreational user. I am a certified and trained practicing hypnotherapist, neurolinguistic programming practitioner, and medicinal cannabis consultant. The information that I share throughout this series is, for all intent purposes, a summary of my studies and research notes on the subject as I have come to understand the topic and can relate it. More information can always be found on my website at www.greenirene.ca. Information is power, and cannabis may not be the cure-all that saves mankind, though in some capacities it is capable. Many facts about cannabis are prevailing over the fallacies perpetuated during the Prohibition era, and the curative qualities of cannabis, mind, body, and soul, are making mainstream conversation, and everyone seems to have some enlightened views about its use and consumption. That said, let's get on with today's episode. In today's episode, I'm going to focus on the curative healing properties of cannabis for chronic pain. I'm going to offer up some techniques for retraining your brain to reduce and evade flare-ups, as well as some healing hypnosis as, as a key for control. On that note, enjoy. Pain is a problem that hundreds of thousands of people have to live with every single day. And in modern times, it seems like pain itself has become the disease. Chronic pain affects everything you do, creating debilitating issues. It really can make life, or everyday life, and its activities seem pretty much near impossible. And almost everybody that is suffering from pain has heard at least one source say to them, well, you should be using cannabis for that. But what does that really mean if you're not already acquainted with cannabis? And if you are acquainted with cannabis, how do you use it therapeutically? These are some of the questions that I'm going to help answer today in specifically to chronic pain. I'm going to answer questions like how cannabis is going to be helpful, what kind you should be taking, and, so on and so forth. Cannabis operates very different from opiates. While most drugs or pharmaceuticals work by blocking neural passageways, cannabis actually catches the pain. It catches it without blocking it, for lack of a better term. Cannabis doesn't work on pain. And that's exactly what Inbal Sikorin, he was the head nurse of the Nyamadak Healthcare and Research Clinics. He says it's not a localized treatment like a lot of medications are. Cannabis actually works on improving and helping the body's entire framework. Therefore, the body can fix itself. Now, aside from pain management, cannabis can also improve things like sleep quality, which will give you better pain management skills. It helps to promote a more positive mood, which will give you better pain coping skills. And it supports the endocannabinoid system, which will give you better pain tolerance skills as well as healing and ultimately regulating your body into a healthier state. Now, professional cannabis recommendations often begin with an individualized evaluation, which helps to determine which compounds are best for the patient's specific conditions. I'm having difficulty with the word specific today. But these recommendations, they tend to involve a combination of cannabinoids and terpenes. So, to clarify, cannabinoids or cannabinoids, depending on how you pronounce it, and that all depends on which part of the world you're in, these are the chemical compounds that are secreted by the cannabis flowers. There's somewhere between, there's over 100 that are known currently to scientists and researchers. And the two most popular, of course, being CBD and THC. Now, CBD is perhaps the most famous cannabinoid compound when it comes to inflammation, and THC is the most famous when it comes to analgesic reaction or efficacy. Terpenes are so you'll hear the term terpenes or terpenoids, and these are the aromatic compounds. These are the smells that are found in the plants. Cannabis plants contain particularly high concentrations of them. Now, terpenes not only have their own set of potential therapeutic benefits, but they can also increase the benefits of certain cannabinoids, creating what's known as the entourage effect. And this means that when the terpenes are interacting with the cannabinoids, the compounds actually increase each other's therapeutic benefits. There are a lot of studies that show while cannabis is beneficial across the board, determining the correct active ingredients for each patient and diagnosing appropriately is rather crucial to the treatment success. Around the world, there is a lot of research that's currently underway to help find and develop tailored cannabinoid-based treatments for various diseases, and many scientists believe that cannabinoids will soon be utilized as a preventative tool based on each individual's genetics, and thus be able to prevent diseases from developing altogether. That which is really, really cool. As cannabis has grown more popular, there's also been an influx of misinformation regarding cannabinoids. There are different strands and compounds that often get lumped together under one canopy without providing the patient a proper understanding of the plant's different properties and compounds. Now, the cannabis product that you choose should largely depend on the type of pain that you want to manage. And there are three main types of chronic pain that I'm going to address today. And they are the most common. Therefore, let's start with orthopedic pain. This includes back and neck pain. This is a naturally occurring pain that stems from the musculoskeletal system. In particular, it affects the spine, the joints, the muscles. Now, years of clinical research shows us that cannabis has repeatedly proven to be highly beneficial treatment for orthopedic pain reduction and management. In many cases, patients have been able to stop long-term opiate usage altogether, sparing them to the many unwanted side effects that go along with a laundry list of pharmaceuticals. So, further to that, research shows that cannabinoids that show the most promise for orthopedic cases tends to be those with high concentrations of THC combined with CBD, which acts as a type of support and activator for the THC. So the recommended terpenes for orthopedic pain include the Parotin, Brunel, and Myrcene. So Parotin-Brunel and Myrcene are the two best recommended terpenes, and you want a high THC with a combination of CBD. Personally, I like a 3-to-1. 3 THC to 1 CBD. So if my THC concentration is 15%, I want a 1%, 3-to-1. No, sorry, I guess a 5% CBD. Okay, I don't do math. The next type of pain that I'm going to address today is neuropathic pain, which includes symptoms that are associated with diabetes, associated with migraines, with lupus, with things like rheumatoid arthritis, fibromyalgia, etc. So neuropathic pain actually refers to the pain resulting from damage to the neural pathways. And this can be divided into 3 different groups in and of itself, like regular pain that's originating from, say, tissue damage, and that information is transmitted to the nervous system. Then there's peripheral neuropathic pain, and that usually results from stuff like damage to the remote nervous system, nerve pathways. And then there's the central neuropathic pain. This is pain that results from damage to the central pathways, such as the brain, spinal cord, or skull. Neuropathic pain becomes increasingly common with age, and notably, it can come on due to direct damage to the nervous system or internal diseases such as diabetes, fibromyalgia, etc., etc. The active cannabinoids that are recommended for neuropathic pain include THC, THCA. So that's THC in its acidic form. So in its raw state in the plant, it is THCA. CBD, which is cannabidiol, great for inflammation. And CBG, which is cannabigerol. Cannabigerol is fantastic cannabinoid that works very, very well on neuropathic pain. Hence, see if that cannabinoid is a part of the cannabinoid profile of the strain that you may consider using. The terpenes that are great for neuropathic pain include humulene, myrcene, beta-caryophyllene, and alpha-pinene. These are the best for neuropathic pain. You'll find them in strains like Granddaddy Purple in very high counts for Purple Project. You'll also find them in many other strains as well. Now, when it comes to inflammatory pain, common diseases and conditions that contribute to inflammatory pain include things like, arthritis, osteoarthritis, autoimmune diseases like fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome, celiac disease, celiac disease, hepatitis, inflammatory bowel diseases, Crohn's, cystic, the list goes on. I mean, it can be a never-ending list, basically, when it comes to autoimmune deficiency conditions. So, some also, a lot of people, myself inclusive, include things, when it comes to inflammatory pain, this occurs in response to the tissue damage and inflammation, and it has become progressively common with increased life expectancy. It can significantly hamper the quality of life of an individual. Therefore, recommended cannabinoids for these conditions and inflammatory conditions include THC, THCA, CBD, CBDA, that means it's in its acidic raw form, CBC, which is cannabichromene, and CBG, which is cannabigerol. Now, common types or common terpenes that are used to combat inflammation include cineal, beta-caryophyllene, myrcene, limonene, and a few others, but those are the tops. Now, study after study has shown remarkable results for patients who treat their pain with cannabis. In one study, after only 6 months of treatment, 93.7% of the respondents reported improvement in their condition, and their reported pain level was reduced significantly. Side effects of cannabis users really are minimal. I mean, the most common side effect that patients report, of course, is dizziness. If you've never used it before, you're not familiar with the euphoria. Some people get cotton mouth or dry mouth, and a lot of people suffer from dry eyes or red eyes. But really, that's about the most extreme of side effects that you're going to experience utilizing cannabis as a therapy for pain management. Now, with the rising number of patients using cannabis successfully to manage their pain, you can actually now find a lot of medical nurses and some doctors who have professionalized treating patients using medicinal cannabis. These healthcare professionals can help a patient find the strains that work best with their specific illness or condition. They can also help you determine if there's any drug contraindications, as well as provide medical support and advise you on making any necessary dosage adjustments based on your precise needs. Now, in order to you can also work with a therapeutic cannabis consultant such as myself, and if you'd like more information about this, we can schedule a discovery call, at which time we will talk about a strategy consultation in order to help you. Notably, not all pain is bad. Acute pain, for example, is the body's natural way to let the brain know that there's an emergency or a problem that needs tending to. Now, it's what we experience when we get, say a cut or a scrape, maybe a burn, sprain, something like that. We might also feel acute pain when one of our organs or biological systems stops functioning properly, like constipation, for example. When we feel acute pain, it's a signal to our brain that something's wrong and we need to do something about it right away. So pain is not necessarily a bad thing. Chronic pain, on the other hand, this is the body's emergency notification system gone haywire. Pain that lasts longer than, say, 3 to 6 months on average is really generally considered to be chronic pain. People who experience chronic pain can also suffer from anxiety, stress, sleep deprivation, depression, drug or addiction or substance abuse, and on top of all that, they're all often stigmatized and shamed by medical professionals, as well as family and friends sometimes. And any of these people can sometimes go as far as to tell the chronic pain sufferer that they're just making it up for attention or that it's all in their heads. Fortunately, there are options for dealing with chronic pain symptoms, and more hypnosis and NLP is truly being recognized as a very effective way to treat, manage, and even eliminate chronic pain. Now, there are a lot of different techniques that can be applied to chronic pain symptoms in or out of a formal hypnosis session. Imagining is one of them. In this technique, you imagine a pain dial, and the person can actually visualize controlling the intensity of the pain by turning an imaginary dial or knob. First, the pain is increased. This helps the person recognize that they do have some agency or control over how pain is experienced. And it's then followed logically that if the pain can be increased, it can also be decreased. People often experience a significant reduction in the intensity of pain when using this particular technique. Another technique is glove anesthesia. And so while we have a client or a patient in a trance state, what we'll do as a hypnotist is suggest a feeling of tingly or numbness in the hand or another part of the body. And this can provide adequate anesthesia for things like dental procedures or even minor surgeries, as well as chronic pain. So moving pain around the body is another technique that we use. Oftentimes it's possible to suggest that the person can imagine moving the painful sensation to a different part of the body, as in the pain dial technique. This reinforces the idea of agency. In other words, you have control over it. And then probably the one of the last techniques that I will use with my clients is disassociation. Disassociation can be achieved using guided imagery and visualization. If you want to experience a guided visualization, check out the show on Wednesdays at noon on the Pace Radio. It's called Cannabis and Creative Visualizations with Green Irene. What I basically do is the first half of the show, so the first 15 minutes or so, I talk about and highlight a particular strain of cannabis, and then the second half of the show, we actually do a medicated meditation, which is approximately 13 to 15 minutes to experience it. It's a type of hypnotic meditation. So the point is with dissociation that while you're in trance, the person or patient, you get asked to imagine yourself in a calm, peaceful, and safe space. If you have difficulty imagining that, I will tell you to pretend to imagine that. This process helps you dissociate from the painful sensations and really get to a place where you're focusing on much more pleasant feelings. Now, chronic pain can also be rooted in or reinforced by past traumas and any other emotional causes. Painful relationship breakups, getting fired from a job, being in a traumatic accident, all of these things can create super powerful emotional associations with acute pain symptoms. And NLPers like myself, we say the same thing. Neurons that fire together wire together. So if you're attaching traumatic experience or painful emotional pain to a physical acute pain in the brain, those wires are now firing together. And if these emotional wounds are left unresolved, the pain symptoms can linger long after the traumatic event has passed. So in hypnosis, it is possible to bring healing to those emotional wounds, and in a lot of cases, that releases the physical pain symptoms as well. Now, no matter what the causes of chronic pain are for you, it can be highly beneficial to include hypnosis as part of the comprehensive strategy to finding healing and relief. Honestly, you want to combine a multitude of modalities and disciplines to help you. At your next doctor's appointment, perhaps, or with your therapist, whatever, talk about collaborating with a hypnotist or hypnotherapist, such as myself, and then you can book an appointment with me to help get you started. You can let me help you find the resources that are inside of you already, and up until now, you didn't even realize were there. We can work together to help you transform your health and wellness into something that affords you the life, the quality of living, so that you can live a life that you love. Schedule that free discovery call with me today at www.greenirene.ca and get started now, right away. The next tool that I use, besides cannabis and hypnosis, and I use this in conjunction with hypnosis, is neuro-linguistic programming. Basically, what that means is training your brain. It's the language we use to train our brain to do what we want it to do our bidding. It's how we talk to ourselves. By chronic pain management, of course, what I mean is persistent rather than intense pain. And really, although it's very difficult to discuss pain objectively, because what's pain to me may be mere irritation to you, or vice versa, I'm going to start from the position that pain is a signal from the brain to let you know that something is wrong. It's for all intent purposes, a warning sign. From there, I'm going to tell you about a recent study from Stanford University, which highlighted over 1,300 possible side effects and drug interactions from prescription drugs that were not mentioned on their patient information leaflets. This study concluded that each pharmaceutical had 329 adverse reactions on average. So if your pain is so intense that you feel you have no option but to take painkillers, then take them for as short a time as is possible, because you just don't want all those bad side things. Pain is a sensation, and it could be, for all intent purposes, argued that we have a choice in how we interpret it. So if we suggest that we need to kill pain, are we sometimes suggesting, or at the very least, giving that pain maybe a little too much credibility? You know, and would we feel helpless without the pain-killing tablets? You get where I'm going with this, right? Ellen Langer suggested that pain consists of many different sensations, and it may be that we could interpret pain simply as a sensation. Sensations, of course, do not remain the same, because a throbbing headache one moment may diminish to the extent where it's barely even noticeable the next. So noticing the changes gives the patient the chance to control the sensations, or for all intent purposes, may need to control them. Indeed, because the pain may subside on its very own. Now, when we return from the break, because we internally make representations in the form of pictures, sounds, and feelings, and I want you to think about this, we're going to examine those further. Because if we're able to change the picture, sound, or feeling, we can probably also improve the way that we are feeling. So, when we return, we're actually going to put NLP, hypnosis, and suggestive cannabis therapies in practice. Stay tuned. We'll be right back after this message from our sponsors.
We are people advocating cannabis education here at paceradio.net.
Who has huge buds? You do. If you shop at BMA Hydroponics, attend one of BMA's educational seminars and learn the secrets of growing, harvesting, processing, and consuming quality cannabis and cannabis products. Learn how to make better extracts, edibles, and medicinal creams at prices you can afford. Visit BMA Hydroponics at 404 Maitland Drive, Belleville, or call 613-967-9888.
The only way to go.
Enjoy the buzz of legalization with Campbellford Lifestyle Shop. From lights to plant nutrients, books, consumption accessories, and more, we've got all your basics to grow or consume cannabis. Visit our info center or take a look at our piercing services and body jewelry, now available in-store through Campbellford Lifestyle Shop.